I'll just wait for people to join and then I'll introduce us and welcome us. Okay, well, welcome everybody to this Periods in a Pandemic event. My name is Emma Craddock. I'm a senior lecturer in health research at Birmingham City University, and it's been the absolute pleasure to be working on this project with Gemma Williams, project lead, and Annalise Weckeser as a co-researcher on the ESRC funded Periods in a Pandemic project, which we're going to hear about today. Sorry if you can hear beeping, it can't be turned off when it's when people are coming or coming and going. So I'm going to be chairing the event today, and I'm really excited to be hearing from our speakers. We're going to be hearing from UK research projects that have looked into the impact of the pandemic upon period poverty and menstrual health during this time, providing the most up-to-date insight into how women, girls, and people who menstruate have been affected during this time. So our speakers for today include Gemma Williams from Birmingham City University, Victoria Tora Abrahams from Freedom for Girls and Black Women's Menstrual Health Project, Rachel Grocott from Bloody Good Period, and Chloe McGuiness from Irise International and Freedom for Girls. Just some housekeeping information to start with. The format of this event is a Teams event, so nobody other than the presenters can put their camera or their microphone on, but we do welcome questions, so please do type those in the chat box, and I'll say a bit more about that in a moment. The structure is that we are going to have 4 speakers joining us. Each speaker will have about 20 minutes to present, and then about halfway through we're going to have a 5-minute break with the opportunity to watch Ricebox Studios' menstruation conversation video before our final 2 speakers present. Once all our speakers have presented, we'll have time for questions. So please do put your questions in the chat box, and also signify who you'd like those to be addressed to, and then I will collect those and I will pose those to the relevant people at the end of the event in the last kind of 15-20 minutes to have the Q&A. So do feel free to post questions as we go. Our first speaker this evening is Gemma Williams from Birmingham City University. She is a research fellow at BCU and co-leads the Family, Gender and Health Research Cluster. Gemma's research interests include period poverty, menstruation and chronic illness and disabilities. She is currently project lead for an ESRC funded research project looking at how UK period poverty initiatives are mitigating COVID-19 related challenges. This is called Periods in a Pandemic, how UK period poverty initiatives are mitigating COVID-19 related challenges. And in this session, Gemma will present the findings from the second phase of this project, highlighting how the pandemic has impacted upon those that have experienced period poverty within the UK. Over to you, Gemma.
Thank you, Emma. I think you've said the title and all of that kind of stuff plenty of times, so hopefully I won't need to go into that side of things. So I can skip my first slide. So I can just go straight into what the project actually is. So our Periods in a Pandemic project, it's myself, Dr. Annalise Weckeser, Emma is part of the team as well, and also Dr. Lydia Aston, undertook an 18-month project from way back from July 2020, which seems like a long time ago now, to December 2021. Actually, today is our very last day of funding, so this is the official last day. We've done 2 phases of data collection. So the first phase was around speaking to people that are providing support in lots of different ways, but to support people with their periods and throughout their menstrual health. And then the second phase was actually with people that had experienced elements of period poverty during all the lockdown periods, periods. Huh? We've been doing regular dissemination in lots of different ways throughout the project lifespan. Some of you may have already attended one of our events that we did, I think it was May last year. So this time I'm going to focus on the phase 2 element, so hearing from the people's actual experiences. So how did we do this? So we ran an online survey from July to September last year. It's not what we'd originally intended, but obviously we were still in and out of lockdowns, only just come out of lockdown possibly. We were hoping to be able to go and actually visit projects and run focus groups and be a lot more collaborative and interactive with people than we actually were able to in the end, which is unfortunate. But you know, we were still able to do this online survey, and we were still able to do some telephone interviews. I'm just going to focus on the survey responses because we actually only got 4 interviews, I think. So not really enough to kind of look at in terms of themes, but the interviews that we did do very much backed up what was in the survey. So just bear that in mind, that this is still, people were saying really similar things basically. So we had 240 people from across the UK complete the survey, which was amazing. We mainly did recruitment through social media, and then we also had people from phase 1 share the survey with people as well. So thank you very much to those people that helped to do that. In terms of who completed the survey, so the majority of respondents identified as white female, aged 21 to 30, and were currently living in England. So this is really specific. There was not that much variation. The findings focus on product access. So we asked people about how easy it was, you know, if they had any problems in accessing products. We asked them about their menstrual health support, and we also asked them about if they'd noticed any changes to their menstrual cycle throughout COVID and the lockdown periods. So first of all, I'm going to talk about the access to products. So of the 240 people, 85% of them reported difficulties in accessing products during the lockdown periods. And these were for reasons like not being able to get to the shops, or shops just not having products. So people that were in this situation, 40% of them were getting products from their family, 37% said that they've made their own with the kind of household items like toilet paper or old clothes. 34% had gotten products from their friends, 30% had made their own reusable pads, 23% contacted an actual period poverty charity, and 20% said that they got products from the food bank. People that were shielding were having problems, and then we were also hearing from people that were key workers that just didn't have the time to go to the shops to get products, so they were more reliant on others being able to get them for them. In terms of menstrual health support, so we asked people if they needed any help with any part of their menstrual cycle or with their periods during lockdown. And this could have been any kind of menstrual health support. So people were talking about how changes in their cycle and changes to their bleeding. So most likely irregularity or bleeding becoming heavier were the main reasons that they had wanted support or advice during lockdown. So this quote here is about someone that thought they might have been perimenopausal, but they didn't feel like they could contact the GP. They didn't have the privacy needed to be able to have a telephone GP appointment. Someone also talking about not being able to get through to their GP. GP practices had changed. They were hoping that they'd be able to start the pill to see if that would help, but they just couldn't have that conversation. So for the people that did need support and advice during lockdown, the main sources that they went to, so most people said that they would go to their friends, or they went to their friends. 48% said that. 40% spoke to a family member. 37% went online to look for support, and only 20% actually received support or advice from a doctor or medical professional. So that may be surprising, that may not be surprising, depends how much knowledge you have about women's health and medical professions. And we've got the women's health strategy that's just come out, so it might not be that surprising that people weren't really comfortable going to their GP or medical professional for support. But from those that actually did go and try and get that support, 63% of them did receive support. So that's really good. So it's like low number of people went to them in the first place, but of those that needed support, that's actually quite a significant high number. Of the people that didn't get access to medical support, so they tried, it was because access to healthcare was either reduced or stopped. People felt really reluctant to bother GPs because they didn't feel that this was important enough within the context of a pandemic. People had problems getting through to book appointments, or there were huge waiting times. And some people, like the example that I've just talked about, some people just didn't have that kind of private space and time needed to be able to do things online or to be able to do things via telephone. So that was a real barrier for some people as well, particularly within the South Asian community, we were told. In terms of the impact on the menstrual cycle, so we asked people if they'd noticed any changes. We asked them what the changes were, and we also asked them if they thought they knew what the changes were linked to. So 80% of people said that they'd experienced some kind of change. So most people said that they thought that was stress related. So 58% thought stress related, 26% thought it was because they'd had COVID, 23% said that they thought it was because of the vaccination, 11% just didn't have a clue what was going on. And the most frequent things that people reported were changes in bleeding, changes in their cycle length and their frequency, and changes to regularity. And some people reported huge delays in their periods. Particularly, these were people that had the vaccination, were reporting really like significant delays from in between their cycles. So some of these quotes, so someone's talking about how it's been really bad since the pandemic, like their period's been so bad they've been referred to the hospital. Again, this is a delayed one. My period was delayed 68, where have I got that from? 64 days after I got diagnosed with COVID. I thought my period would never come back. This person's saying that you know, their periods lasted 3 weeks because the implant that they had, so contraceptive implant, had failed and they've been unable to get it removed and changed. So a few people mentioned that they still had implants that weren't working and had problems getting them removed or changed because of these other problems in being able to access GPs. So the people that had experienced changes with their menstrual cycle or their periods, 61% of them had actually changed how they managed their periods during lockdown. So these were people talking about how they'd had to kind of think more about planning and being prepared because of irregularity, people keeping stocks of products because they couldn't get them or they'd had problems getting them during lockdown, people taking a lot more pain medication because they'd had an increase in the pain. Some people changed their products. So quite a few people talked about how they'd swapped to reusable products. Things like period pants because they had this change in bleeding and this irregularity that they were experiencing. People also talked about how working from home was really beneficial when they were on their periods. It was more comfortable, didn't have to worry about leaks or visible leaking, particularly for people that experience quite a lot of pain. That being able to have regular access to your own toilet and your own toilet, one person had very strong views about being able to access their own toilet and not the horrible work toilets, and how that was a real benefit to be able to work from home. Some people mentioned being caught out and not having products when they needed them, and this was mainly linked to products just not being available in the workplace. So particularly this related to, I've already mentioned about the frontline workers and people just not having products in the workplace that they could access. So this person talks about how they were really unprepared and they had to borrow a tampon from friends because there was nothing available at their workplace and they were on shift in the NHS. And this hadn't actually happened to them for years. So for some people, this was quite a change for them in terms of how they manage their periods. So a very quick summary. Many of the findings from this phase, from phase 2, echo what we found in phase 1. And so in phase 1, organisations were talking to us about an increase in requests for products. And these were because of the same reasons that the phase 2 people, survey respondents, reported. So just not being able to access products, the shops not having products, people shielding these different groups that have popped up, like NHS frontline workers, and financial issues that have been exacerbated by, because of the pandemic. Organisations also told us how they had received an increase in requests for menstrual health support that was linked to problems accessing GP services. I've just talked about how survey respondents had gone into some details about that. And again, organisations talked about how the people that are getting in touch with them, that they're not really knowing what's normal and what to expect during their period, in relation to their periods during lockdown. And they were worried about changes being linked to stress or to COVID or to the vaccinations, and just not having that information and that knowledge. I know there's recently been a report and some research that's come out that's showing that people's menstrual cycles have changed after having the vaccination, and some of them have, some of the media reports have then gone in to explain why that happens. So that information is coming out now, and people didn't necessarily know that at the time, but it just shows that there's a gap, another gap in terms of people's menstrual health education, that we don't know that getting ill, that stress, that vaccines can cause changes to our menstrual cycles, and it's something that can happen. So the kind of fretting and frenzy and worry about it can be reduced greatly just by knowing that. So what does it mean by phase 2 echoing many of the phase 1 findings? So it's really encouraging because it shows that in the UK, support for people experiencing period poverty during lockdown is actually reflecting the needs of the women, girls and people who menstruate. However, the support that's in place is it's often because there's no central structural support and there's no policy around menstrual health. Where there are things, it's not consistent. The UK as a whole is really inconsistent in its approaches to menstrual health, which is when the UK government a few years ago pledged that they were going to end period poverty by 2030. But my question to you is, if you take everything that I've just talked about into account, is that actually feasible? And how might that look? So that's me, very quick run through of the phase 2 findings. Our final report is actually available now for people to download. We're gonna pop the link in the chat, and it will be sent to you afterwards as well. So it'll be sent to everyone that signed up to the event. It's the full report of the whole 18 months and the work that we've been doing, so that's available to download now. Please do have a look, please do share it, and please do get in touch if you have any questions. Thank you.
Thank you very much, Gemma. That was a really thought-provoking presentation with lots that I'm sure we'll be mulling over. Our next speaker is Victoria Abrahams, or Tora. Sorry, my cat's joined me as well. Tora is a business development specialist supporting voluntary organisations with their strategic planning and fundraising needs. She actually originally qualified in human rights law, representing women and men with their access to services and justice in prison law settings. And it was through this work that Tora developed an interest in women's specific support after she represented a client who refused a strip search while she was menstruating and was successful in a civil claim against the prison service. Her work with Freedom for Girls started in Leeds, but soon expanded to Uganda and other areas of Africa, where she developed a co-sex education programme and training on the importance of decolonisation practices for domestic charities with an international reach. In this session, Victoria will be talking about Freedom for Girls' Black Women's Menstrual Health Project and the surveys and peer support groups that the project have been running during the pandemic. Thanks, Tora.
Thanks so much, Emma. Hi everyone, nice to see your names, can't see any faces, but let me share my screen and hope that it works. We had a trial situation before that kind of did, but I'm hoping you can see that. It looks good, okay. So thanks for the introduction, Emma. Yeah, my name's Tora, or Victoria. You'll see that in sort of my email and promotional bits about the event this evening. And as Emma said, my background in period poverty work has been mostly through a personal passion that started when I was a lawyer, but moved into the voluntary sector when I did more business development and operations work. I speak on behalf of Freedom for Girls this evening. What I'm going to talk about is both the impacts on the pandemic of our general practice, but also how during the pandemic and issues that arose specifically for the Black community and the rise in interest and the campaigning around the Black Lives Matter movement and how that sparked within Freedom for Girls to do more work to represent that cohort of people that we were already so closely working with on account of how inequality impacted African and Caribbean people, and therefore how we moved into creating a project specifically designed to support Black women. So who are Freedom for Girls? So yeah, we are a registered UK charity, but we practice in both the UK, predominantly in West Yorkshire, Leeds, and as you can tell, I'm from Manchester as well, so we practice mostly across the north, and we fight against period poverty. And we, as an organisation, subscribe to the original Plan International definition of what we mean by that. It is covering the three main areas of a lack of access to products, poor or complete lack of education around menstrual health, but also the stigmas and shame associated with periods. And with that, we dress that up as kind of, the services go into what the definition is. So it is by providing access to products and engagement with the community through surveys, peer support groups, advocating for choice in products as well. So a lot of work that we are starting to do heavily this year is looking at the environmental impacts of period products as well, and advocating for access to safer and plastic-free products as well. With our campaigning, we're really proud to say that a lot of the work that we did on a local and national level has been implemented. You'll know about the Department of Education's programme just before the pandemic hit, where free products were provided in schools January 2020, and also we have supported in that on a local level with the Leeds Local Authority as well. And education, as Emma mentioned in my introduction as well, we are passionate about ensuring that our education programme isn't just science-based, and it's a lot more detailed than just the 2 to 3 sentences in the UK education curriculum. It is about removing stigmas, removing shame and taboos, focusing on empowerment and confidence building, and providing that safety within ourselves as people who menstruate in respect of what periods mean and how they change throughout our lives. They change if we're on contraception, for example, and the awareness and the safety around what that means. And here's just some pictures to explain that. So practically, day to day, we are in the streets collecting products from typically members of the public, just like the food bank donation station boxes at the end of, you know, your food aisles at Tesco, we have them for period products as well. And I'll come on to how that was impacted during the pandemic. We also then donate them to members of, to community leaders and other voluntary organisations who provide services to a range of people who menstruate. And we also, like I said earlier, with the campaigning we're doing around access to plastic-free products, we run sewing workshops both in Leeds and in Uganda and Kenya, our main areas in East Africa where I practice. And the education programme we run, it is so heavily, like I said, about removing stigmas and shame as much as it is about telling you the biological process of periods. So I've written here pre and post pandemic, but, you know, we're not really post pandemic quite yet, but we're definitely in a different state of the pandemic, or stage, should I say, than we were in 2020. And I've referenced the reasons that Freedom for Girls started our work. We contributed to one of the original pieces of research around period poverty in 2017, Plan International's Breaking the Barrier report, where there was some data in there that's, well, all the data was about how period poverty is impacting particularly young women and girls. So there it says 1 in 4 across the UK felt they were underprepared at the start of their periods, and 1 in 7 didn't know what was happening. And that, again, as I keep repeating, is about education, knowledge through power. So we work around that in all our areas of work. And then 27% of girls said that they'd overused a pad or a period product and couldn't afford a fresh one. Fast forward to how that's been impacted by the pandemic, and Gemma highlighted so much around that evidence and the evidence-based research that showed the struggles that people were experiencing because of the change in our day-to-day lives. This is something that Plan International also did a fresh report on in May 2020 and impacted a lot of the work that we do internationally as well, and fed into that. And I'll come on to how that impacted Freedom for Girls' remit. But as it says here, it denied standard access to period products, and schools were closed for such a significantly longer period than the UK schools were. So a bit of that evidence that we collected, qualitative and quantitative, and I'm sorry, this is quite a text-heavy slide, but ultimately the main areas that it impacted us was to the donation of products. So either through our corporate providers or our members of the public and supporters and volunteers who were able to give us access to products, because we were just, supermarkets were difficult to access, where we have donation stations, offices were closed, supply chain problems with our international providers meant that we weren't getting as many products. However, as it says on the second point on the left there, we were getting 7 times more the requests than usual. There was such a significant shift in who we would identify as economically vulnerable compared to years before the pandemic. And so that meant that we were getting called upon a lot more. And then the education programme became really difficult for us, obviously, to deliver because we weren't accessing schools. And we were being given anecdotal evidence from a lot of our partners who also work around period poverty. Hey Girls UK is one of our big corporate partners who focus as much on the importance of education and removing shame around periods. And they were reporting to us that a lot of information that they'd had from single fathers or people who don't experience periods, and just saying, I don't really know how to talk through this with my young child, and it's causing issues and I'm worried about their health. And then access to GP services were reduced and so on and so forth. And then in terms of our East Africa work, the reusable products were not able to be sent out, but also the sewing workshops in those areas were completely closed down. The lockdowns were a lot more severe in some ways. You weren't, even supermarkets were closed, and there was delivery of food in a lot of places in Uganda as well. We also talk about the vulnerability of a lot of young women and girls there. As you can imagine, sex-based inequalities present all over the world, but in certain areas where economic vulnerabilities are so rife, this is how it was impacted young people there. So we know that there were significant rises in teenage pregnancies, for example, not solely because there wasn't the education around safe periods and safe sexual health practices, but also because young women and girls, we've learned, were selling their bodies and going into sex work just to afford to move to get through the pandemic, in essence. And there I've also added that, you know, the lockdown in Uganda was from April 2020. That's the longest world school lockdown from then until just reopening in January 2022. So the impact of the lack of education and the social issues, with that was really, really clear as well. that's been an ongoing issue for Freedom for Girls, but obviously in the UK work, we've been in and out of the lockdown, so it's gotten a little bit better in terms of our delivery of our services, but it's not stabilised yet. We're still in an era of lots and lots of need, and we don't think that's going to let up anytime soon. In terms of Black women's menstrual health, sorry, I've kept this slide really vague because I wanted to be able to speak openly about why we decided to go forward and put together a project that's specifically designed for Black women. And also I'd want to caveat that with, whilst we call the project Black Women's Menstrual Health, Freedom for Girls is absolutely an inclusive organisation. We represent and support anybody who experiences a period. You will have heard me already reference people who menstruate, but also women and girls, and in this section I'll refer to female reproductive health and menstrual health as well, female menstrual health, because for the circumstances of the way that we report, but the emphasis is absolutely on that we are all inclusive of anyone who doesn't identify as female, doesn't identify as a woman, but experiences menstruation and all the issues that go with that accordingly. So if we can rewind, which for me sometimes feels like 5 minutes ago, but then also feels 10 years ago, to the summer of 2020, after we were already in our houses for so long and we were glued to our screens, both for work and socially. And obviously there was a huge eruption in the Black Lives Matter movement following the murder of George Floyd. And from our perspective as well, a lot of women who were impacted by that, Breonna Taylor being one. And as an organisation who predominantly works with African and Caribbean people within West Yorkshire, but also obviously in East Africa, we recognise the importance and our obligation and responsibilities to create a project that was for this cohort. Systemic racism and racism itself, individual experiences racism and structural racism are things that have been increasing for many, many years through the xenophobic behaviours of politicians and through instances that have impacted the rise in global capitalism and inequalities as a result. And we know that there was something that there was a need for us to address it on a menstrual health level as champions and experts within this field. So from our point of view, we had some evidence to suggest that there was a need towards this as well, not just because of the structural issues I've mentioned, but because we also were aware of some quite important research that was coming out of predominantly America. So people might be aware of the work that Serena Williams did. She had big issues when she gave birth during her late term of her pregnancy in labour, and she felt like she wasn't being heard. And the big reason for that was because she thought it was because she was Black. And we also coupled that with some research around perceptions of the Black woman, perceptions of what it means to be Black, and the way that Black women are. The word perception, sorry, is the only thing coming towards me, but the negative stereotypes is what I was looking for as well. And there was some research also that we found coming from Stanford University in America roughly 5 years ago that said that of all the white and non-people of colour medical students that were surveyed, 51% believed that Black people did not experience pain. So combined with the conscious or unconscious bias from individual medical professionals, with structural racism and discrimination, we are absolutely recognise that if that exists in female reproductive health with regards to pregnancy, the likelihood is it's going to impact menstrual health as well. We also look holistically at what menstrual health means within this project. Does it mean from the stage of menarche and your period all the way up to perimenopause and menopause and the nuances in between? And we've really worked hard to make sure that we are covering what it means, that each stage of your period, but also what that means for you when you are a Black woman. And our definition of that is a woman who identifies from African and Caribbean backgrounds. I'm a woman of mixed heritage. I identify as African, but I also add on to this call, I can't see anyone's faces, but we are very, very conscious that I'm speaking on behalf of this project as a representative, whilst also recognising that my experiences of racism will be different for the nuances within biases and discrimination that are pertaining to colorism and featureism, hair texturism. And so my wider team are made up of stakeholders and beneficiaries as well as allies who are from different backgrounds. And at the end, I'll talk about, if anyone wants to get involved, what that looks like. And so if this project speaks to you on a personal or personal activism level, then please obviously do get in touch as well, because we want this to be something that impacts more than just the community itself. In order to see some kind of tangible change, everyone needs to buy into this concept. So I'll stop waffling with no text on my slide and move to the next one. So this is an overview of what the project is trying to do and our project aims. So it aims, as it says, to address systemic racism and unconscious bias in female reproductive health in the West. So we're focusing predominantly on healthcare systems within the UK, our main area of practice, but we also have partners within some places in Europe and the USA. And we've done that on the basis that we have seen other evidence that shows healthcare structures are really similar, and the diversity of representation of people from different racial backgrounds is similar in those areas. The main area that we're working in, though, is obviously the UK. What we're trying to do is highlight the experiences of girls, women and people who menstruate, who are of Caribbean or African heritage, when they are seeking healthcare support for their menstrual health needs. So based again off what I mentioned in terms of Serena Williams' experience, when you are going to a healthcare professional, specifically about your menstrual health needs, what has that experience been like for you? And I'll come on to the methodology around our work, but that is the main area that we are speaking to people who are impacted, direct beneficiaries of this project about. Within highlighting those experiences, we also want to understand the impact of how systemic racism and unconscious or conscious bias has impacted those experiences. Together, they make up a research and report piece. Underneath that, we want some tangible aims for the beneficiaries themselves. We want to be able to write about something and gain that data to turn it into something practical for people to be able to use to see change individually, but on a community level as well. So the advocacy side of our work is as important. And with that, the advocacy will come through with the report and also with a resource. Again, we want this to be accessible. I skirted over the communities that we work with in Leeds that are supporting African and Caribbean communities, but so many of them don't even have smartphones. They're a part of digital poverty, and we want resource that we create to be accessible to everybody. So the dream would be something electronic and online, and then something that is physical and practical for a little piece of literature for people as well. We also want to work with some EDI specialists to look at what training is needed for healthcare professionals to better the awareness of the impacts of the biases and racism that Black women experience, and to make some more noise about the issue itself. So how are we doing that? So far we have created and promoted surveys. I can talk a little bit about, and Gemma spoke similarly as well, about the impact of the pandemic on getting engagement with people to do one-to-one interviews, focus groups and surveys. The surveys has been a big challenge for us. We feel that it's something, two things really, and I didn't really fully prepare an answer for this, but what the team has talked about is people are kind of getting bored of being asked to do stuff, especially the newsletters that we get, the requests for information, that there's been a lack of as strong as engagement as we would have hoped for, given the number of methods that we've used to promote. And those include our standard newsletters, standard use of social media, asking for the support of other organisations and charities to use their Instagram stories or their timelines or Twitter accounts, Facebook pages to promote our surveys in the project, as well as in-person surveying. Obviously, because of the varying lockdowns, I can't believe when Gemma said before that, did we get out of lockdown in July? I feel like July last year was the time we knew we could go to the pub and sit inside. And I think that's when we also, as a team, we were like, what do we do now? So can we start seeing people in person kind of thing? And so, yeah, the in-person survey started only from last year and the project started the year before. And we want to do more around that. So again, for anybody who works on a community group level, if you want to get involved with the project for both the next thing I mentioned around peer support groups and surveys, please get in touch. But yeah, with the data collection side, we also ran focus groups. We ran a few in May of last year, and they were quite well attended, and a lot of amazing information was provided off the back of that. We asked some really difficult questions, particularly around how do women feel when they are speaking to a healthcare professional who does not look like them, whether they are someone who doesn't experience periods or they are not of the same racial appearance as them. And that for us was a big kind of warning sign that we need to look at the nuances within how we are approaching this as well. So it says on the right with some of the results that 37% of the people that we surveyed faced a lack of representation. And some of the questions in the focus groups was, how do you feel if an obvious white male doctor was talking to you? How do you feel if a black male doctor was talking to you? And what about a black female doctor? What's the difference is that? And some of the answers were amazing in terms of the feeling of safety, the feeling that you don't have to let another barrier down when you're speaking to someone, as if it takes away some of the emotional labour that you go through as women generally in terms of talking about your menstrual health. But the peer support groups has been an add-on to that, and they have been great in terms of the emotional support that a lot of women need in these circumstances. I think menstrual health itself is such an underspoken topic, and we've got evidence to suggest that, and so much goes into the fact that healthcare systems are so patriarchal anyway. They're very few have the needed person-centered approach for women's experience of reproductive health. So within these peer support groups, we've been able to create those safe spaces to talk about that, as well as within the racial lens as well. And yes, some of the data that we've got is 53% of survey respondents faced barriers due to lack of information and education, 37% face a lack of representation, and 21% expressed how their doctor was dismissive of their symptoms and concerns. And that's something we'll be going into the final report.
Just to say, you've got a couple of minutes left, Tora.
Thanks very much, Emma. This is just some of the the quotes and case notes that we've had from some respondents. So a lot of them have expressed their difficulty and personal issues with their menstrual health, and then what that's been like in front of doctors. So dismissive of conditions and waiting 10 years to be diagnosed. That's been quite a regular one. The 10 years diagnosis hasn't always been the case, but waiting for years for a diagnosis has absolutely been, including the fact that there are some conditions that are much more prevalent in African women, such as fibroids. And then again, stigmas and shame around different parts of periods, not just the standard period, but the different symptoms that women experience for the different conditions that are menstrual health related, and so on. So there's that, but also, what do we need now in terms of support? I didn't mention at the beginning that I'm absolutely indebted to my amazing team that's around us doing this work, but we're all volunteers. We've been doing this for nearly 2 years without funding, in our spare time as and when we can. So we are looking now for collaborative support and fundraising support for anybody who wants to be able to help us with the resource development, specific resource, and also providing us with the resource. And that's it. So also looking for people to participate in the project. So as many beneficiaries who want to get involved as possible and help us promote. So if you have a big Instagram following or social media presence, or you have a lot of people in your network, you work for a big organisation, you might work for a Black-owned business, please get in touch because we want to work with you. And that's our contact details, basically. Yeah. And the last thing, really quickly, sorry, Emma, is that we did create a book last year for International Women's Day, and we are still plugging this. It's called A Letter to Your Younger Self, written by adult women and people who menstruate, and giving advice on different topics of their childhood that might support young people. So what was your first period like? What was your first time having sex like? Have you been through anything difficult in terms of confidence and identity and becoming yourself? So we've made this book and we've published it, and we're still selling it. And so a lot of that, if this is an idea for you for someone's birthday or Mother's Day or something nice, like there's some poems in there and a lot of artwork as well, female empowerment artwork. So just like I said, a little plug, because like I also said, there's no funding for this project as of yet. We haven't been successful because a lot of Black organisations need support. So there we are. But I'll shut up. I'll stop rambling. And thank you, Emma and Gemma and Carolina, for having me.
Thank you very much, Tora. That was really, really interesting and amazing to hear about the work that you're doing. And yes, so many ideas. And there's been quite a few people putting comments in the chat as well, so they'd love to link up and support the project. So that's wonderful. We have now got a short break with a 5-minute video that we're going to show from #menstruation education, I believe, and that's going to be shown for this 5 minutes, and we'll be back with Rachel after the break. Thank you. Hopefully people enjoyed that, and Carolina's put a link in the chat to that particular short film if anyone wants to look at that again. So our next speaker is Rachel Grocott from Bloody Good Period. She is the Director of Communications and Public Fundraising at Bloody Good Period, which provides period supplies to refugees, asylum seekers and those who can't afford or access them. They are celebrating their 5th birthday while also working really hard to make sure that they don't have a 10th birthday. And Rachel has 15 years of experience with a range of charities, both large and small, and has found her feminist fire talking all things period with Bloody Good Period. As part of Rachel's work at Bloody Good Period on starting period conversations and normalising menstruation, she worked with agencies B&A and Fever PR on a piece of public research into how the pandemic has impacted our collective experiences of periods. In this session, she will talk through the findings and their implications. Thank you, Rachel.
Thank you so much, Emma. Right, let's see if this works. There we go. Hopefully you can all see that. I'm sure someone will ping me a message if you can't. So hi everyone, good evening. Thank you so much for having me. My name's Rachel and I look after comms and fundraising at Bloody Good Period. We did this research project in the summer of last year, which, as other speakers have noted, feels like a bit of a blur. But hopefully you will find some of the results, and it is a taster of the results because it was quite a big piece of research, really interesting. So why did we do this work? This started off as a conversation around driving PR coverage. So we were approached by the agency Emma mentioned, Fever PR, who wanted to support our work, and they suggested that we do some research to get data to get PR interest. And we wanted to do that because, as Emma mentioned, we have this objective around normalising periods, getting period conversations going. As we started designing the questions, we realised this was just an amazing opportunity to really understand how the pandemic has changed people's experience of their periods. And I think we probably drove the research agency a little bit crazy saying, oh, can we just add one more question on topic X in? Because we did, I think, go a little over scope. So we were kindly supported by a research agency called B&A, who did the survey and data analysis for us for free, which we are very grateful for. What we did, apologies for all the words, but I'll just run through the basis of it so everyone is familiar with where the data has come from. Online survey with 1,000 people who menstruate. Those are people living in the UK, and we did the research last July. The demographics are there just for reasons of brevity. I've included the largest identifier in each of those categories. We did put quotas on to make sure that we were being as representative as possible. People self-identified in terms of gender and also ethnicity. Really important to note that this is not a study of people in period poverty. So 98% of the people we spoke to could afford period products. We made sure we defined what we meant by menstruation at the beginning, just to make sure that we were crystal clear what we were talking about. The survey was quite long. It was about 20 minutes. I'll come back to that a bit later. And we had a mix of closed and open-ended questions. We really worked hard to try and be as open and neutral as possible. So we gave positive and negative adjectives for people to choose from. For example, those were randomised, so it wasn't always one type that started a list. And I've mentioned the fabulous B and A already. So these are the highlights that I thought I would pull out for this session around people's perception of periods overall, negative to neutral, specifically periods in a pandemic, and I'll tell you what I mean by good, bad and silver linings, although I think other speakers have already touched on it. It feels particularly timely to talk about periods at work today, as we've all been told we can abandon working from home and go back to offices. And something I think everybody on this call will probably wholeheartedly agree with, but lots of evidence in this piece of research really underlining how much we just need to be able to talk about periods. But kicking off looking at periods overall, people's experience of menstruation is mostly negative, some neutral, very small group saying it's positive. So we asked this very general question, and found that nearly 60% have a negative experience of menstruating. a quarter are neutral, and just 16% are positive. So this is not specifically linked to the pandemic. We didn't specify pre or post, we just asked people how they were feeling in July of last year. Which 3 words best describe your experience of menstruating? So these were things that people could choose from, but they were randomized for each person. Top 3: inconvenient, uncomfortable, painful. If I go down to the next slide, you will see positive ones starting to come in. So we also gave people the option to choose things like beautiful, energizing, enlightening, unnoticeable, and you can see that the percentages are far, far lower for those ones. And that's not surprising looking at this data around how people would describe their flow and their pain levels. So 77% reported experiencing heavy periods. That was on a scale of 1 to 5, and heavy was defined as everything above 3. And the same scale for pain, 65% of people said they had painful periods. And of that latter group, 13% of them described it as unbearable. Emotions and periods, we asked whether people had ever felt these things. 73% said they had been embarrassed about their period, a whopping 92% frustrated, 79% worried, 70% angry. And this is a long quote, but I think sums up the kind of thing that people told us. Menstruation is something I struggle with a lot. I feel constantly frustrated that I have to go through it. I dislike the general attitude for women is that we should just get on with it because it's part of being female. I dread my period. I run multiple packs of contraception together to avoid experiencing it. I feel dirty, mentally, emotionally, physically, not myself. It's a horrible feeling. I hate the inconvenience of not being able to do anything to the full, counting the hours my tampon has been in for. And this is quite an extreme illustration, but there were lots of quotes of this type of people really showing how negative their experiences are. Someone else summed it up a bit more succinctly: periods suck. Moving on to look specifically around periods in a pandemic, good, bad, and silver linings. So a significant proportion of our sample, I think it was 95%, their daily routine had been affected by the pandemic, and 70% were working from home some or all of the time. And we asked them how working from home had affected their experience of periods. Nearly 55% said it's made it better. 9% said it's made it worse, and there was a group of people who said it hadn't had an impact. So looking at people who said it had made it better, we asked them why. Top 3 reasons: being able to cope with physical premenstrual symptoms, so headaches, cramps, and so on, over 77%. Being able to cope with bleeding more easily, not having to worry about leaking. And this echoes some of the things that Gemma said earlier on. Some of the changes people experienced as a result of working from home, this was the most common change, and again echoes what other people have said about people trying new types of period products. So I think I'll skip over that because it's already been discussed, but we definitely saw that coming through. Some people said they stopped using as many period products. A significant group said that they had less stress to deal with alongside menstruation. So I guess if you think about taking out the commute and maybe some office politics and other things. And that resulted in things like lighter bleeds, periods becoming regular, less physical symptoms like headaches and cramps, and emotional symptoms too. And this is what people said about those things. So we saw a lot of this kind of thing, being able to track their cycle. So people started doing this for the first time. They learned a lot. Lots and lots of references to people coming off hormonal contraception for all kinds of reasons. The comments about implants failing made me think maybe that's part of these decisions as well. People doing things practically differently. So several people said things like this. So free bleeding on lighter days, people being able to exercise more when working from home. So that helped them manage the physical and emotional symptoms. and using different methods to, I think that should say, to manage period pain. So people taking naps and working in different positions. Obviously, you can do that at home, but in the office, those things might just be frowned on. Looking at those people who said working from home made their experiences worse, this group of people were more likely to say that they had more stress to deal with alongside periods. So I think we can probably all identify with that in one way or another about having experienced increased stress in the last 2 years. So of course, other people said they had heavier periods, that stress had made them irregular, that people hadn't been able to look after themselves in the way they would like to. Changes that this group had experienced included more emotional symptoms, irregular periods, more stress, more physical symptoms as well, heavier. Here's some of what they said. I thought this one was interesting. I can definitely identify with this. Less able to keep track of time in lockdown, so less sure when due. People talked a lot about more discomfort and fatigue, probably linked to that stress, but really severe symptoms as well. So anxiety, depression, thoughts about hurting myself or taking my own life before having a period. One person told us about a 2-month-long period, again, echoing what other people have said. Haven't had that as a symptom since I was a teenager. That person suffered from PCOS. And then, of course, periods disappearing, but also periods lasting for months. So just dramatic changes to people's cycles that they experienced during the lockdowns. And of course, not everything is one or the other. Lots of people found silver linings in a really difficult situation. For example, I've definitely felt more emotional toll when it comes to my period because of the pandemic, but it's given me space and time to learn more about it. And we saw lots of those kind of comments summing up good and bad things. I wanted to pull out some work things specifically as well. Again, this echoes other things that have been said. So we asked about people in employment. For them, had periods affected the way they did their job? 73% they had struggled to do their job in the way that they would want to. Nearly half had taken time off work directly because of their period, most often 1 to 3 days, but 6% said that they were taking a fortnight or more off. These are the reasons. So top 3, low energy, being in pain, less concentration, and some quotes to illustrate that. I think the top left one about diarrhea is particularly telling, like field work, often long days without access to toilets. That came up a lot. Long journeys, teams of all men. Not exclusively, of course, but we do find this a lot, and we get a lot of social media engagement on that topic as well. Being in pain, having to go to the toilet every 30 minutes, severe bleeding, actually leaking, having to deal with it at work, and regulating emotions. If you have a job where that is essential to what you do and you find that hard because of your period, that has a significant impact on your day-to-day work. So unsurprisingly, and again, echoing what other people have said, 81% of the respondents told us they would prefer to work from home when they are on their period, for all kinds of reasons that make complete and utter sense. And when we asked people if they would like more support at work, this is what people said. So 54% said that they did want that support, and this is what they said they wanted: the option to work from home, which, as I say, is particularly interesting on a day when we've all been told to go back to the office. It feels like this could and should be a point in time when we could collectively rethink what we want our workplaces to look like. And I think we've all demonstrated over the last 2 years that working from home can work, especially when it has these kind of benefits for people who have periods. So what an amazing thing it would be if we could take the silver lining that we've found from the pandemic and turn it into a change for workplaces. Free period products, unsurprisingly, is also popular. Flexibility, but also culture change. So open conversations, support from employers, training as part of our Bloody Good Employers programme, which specifically looks at periods in the workplace. We find that those kind of things are huge barriers. If you can't be open about your needs at work, it can have a significant impact on your well-being, and then other things as well, like productivity at work. So what needs to change at work? A few quotes, lots and lots and lots of people saying they wanted sinks in the toilet cubicles so they could wash out their cups, probably linked to the increase in the number of people who tried those over lockdown. But related, lots of people just saying they needed a bin to put their products in as well. Lots of reference to breaks. So this just is not factored in at the moment for all kinds of professions. So people pointing out that everything should have a break every hour, just for very practical reasons. And I think this one is really interesting about just being able to control your environment and the things you need, like food. I mean, it's pretty basic, but if you can't control what you eat and when because of your work, it can have implications like this, which is obviously, has a major impact on people who menstruate. So that opportunity to redesign what workplaces look and feel like feels like a really major one. And the last section is about talking. This survey was really popular. B&A, who run research on all kinds of topics for all kinds of clients, including kind of big corporates, were surprised at how quickly we hit the target number for completed surveys. We weren't, because we know that people really like talking about periods. So these were some of the comments we got. Thanks for doing this survey. Periods aren't talked about enough at all. So thanks for being there for us people who have them. Nice to complete a survey that focused on this particular subject. I'm glad that I played a part in it. So lots of feedback around that and a really speedy response rate, but also people saying things like this. Having no bleed for 6 months isn't normal. You should go to the doctor. I'm too frightened to go myself, which I think just really underlines that first point around people are having negative experiences so overwhelmingly. And certainly for me, being in this space, thinking about periods every day and having access in a very privileged position to lots of information that makes my experience a lot more positive than it used to be. This research has been a really powerful reminder that lots of other people do not have that experience. So just briefly on the results that we achieved with this project, we did get the PR coverage that we set out to do. So our founder, Gabby, who many of you will know, did a press interview, which was recorded and packaged up for local radio stations, and it got a lot of traction. It did really feel that for those outlets, talking about periods was pretty new and revolutionary. So the kind of tone when they were talking about them was, wow, would you believe that the pandemic has also affected people's periods, as if it was something really revolutionary to be talking about, but I think it was. So in terms of our objective of normalising, of starting conversations, we're really pleased with the outputs from that. That also gave us a small uplift in donations at a relatively quiet time of year. It wasn't linked to a date, it wasn't International Women's Day, it wasn't Menstrual Hygiene Day. It was the summer, it was quiet, and we did see a small but significant uplift, which we were very grateful for. I've mentioned Bloody Good Employers. That programme is now live. It's all about supporting UK workplaces to better support people who have periods at work, and it looks at communications, culture and policies. So it gives us more data to illustrate why that is so necessary and the impact it can have. As I mentioned, I think it gives us a greater understanding of audiences, really powerful reminders in there. And I think this is the main thing for me. These findings are for people who can afford products. Those who can't are experiencing an additional layer of stress, anxiety. I don't think those words are probably even enough to encapsulate those experiences. And that's just totally unacceptable. You know, the fact that people are having these negative experiences and then not being able to afford products on top is just quite extraordinary for the society that we should be. And that's why we'll continue advocating for change. And I'm going to use the unprecedented word because I don't think it's a presentation about the pandemic, right? If we don't say it's an unprecedented situation, it's mandatory to say that. But hopefully this has given us an understanding of how that unprecedented situation has changed our collective experience of periods. And that is me. Thank you so much.
Thank you very much, Rachel. Again, really interesting findings, and also really interesting and great to see how findings are chiming with each other across the presentations. So before we go to questions, our final, last but not least, presenter is Chloe McGuiness from Irise International and Freedom for Girls. Chloe currently works with Freedom for Girls as an education workshop coordinator. In this session, Chloe will present the findings from her research, which explores the power and control of women, girls and people who menstruate during lockdown measures in the UK. Chloe submitted her MA dissertation piece in September 2020, undertaken in partnership with Irise International to provide research to aid their work. Over to you, Chloe. Thank you very much.
Thanks, Emma. That's great. Carolina, are you okay to just get my presentation up because I'm having some Teams issues? Please. Perfect, thank you. Okay, that's great. Just in the interest of connectivity with my computer, I am gonna go off camera. So just bear with me. Okay. So I'm Chloe. I conducted this research during the pandemic in the first lockdown, and I looked at the impact of lockdown measures on power and control. So in terms of the partnership scheme that I did, it was a master's degree partnership scheme, and it offered the opportunity to collaborate with a charity for my dissertation project. The partnership pathway provided an opportunity for students to create an to create a dissertation in conjunction with a charity. The research produced is intended to be used by your chosen organisation in order to assist with projects or policy. So for me, Irise was the only option, as I was aware of how far-reaching the problem of period poverty was through my own work with Freedom for Girls. Irise is a global leader in menstrual health programming, research, advocacy and policy development. So pursuing this partnership gave me an opportunity to work as a young researcher and provide research that is useful to a charity. So in terms of researching in a pandemic, so after the partnership was formed, it is worth noting that I initially settled on a different project, which was levelled at exploring young people's experiences on menstruation. I originally intended to conduct focus groups and collate data in this way. However, with the onset of lockdown measures in March of 2020, I decided to adapt the research to the circumstances we were enduring. Focus groups were no longer feasible, which has been mentioned by some others, due to COVID restrictions, and I therefore had to refocus my own methods and my research plan. And the circumstances provided an opportunity to conduct research during a global emergency. Articles that were published early in lockdown indicated women, girls and people who menstruate were experiencing increased risks and impacts in the form of domestic violence due to the stay-home order. And I therefore began to research if this was a regular occurrence in terms of a crisis. So my research focus was how has the power and control of women, girls and people who menstruate been affected by the COVID-19 crisis. So as I was conducting initial research, there were constant articles being published on the widespread economic instability, the pressure on food banks and the increases in gender-based violence. So I felt this would be an insightful research project. And in addition to this, I was aware that many period poverty charities were working at higher levels than previous, and it highlighted that periods don't stop for pandemics. So for my initial research, I had to depend on case studies as COVID-19 was a completely unprecedented situation. So I turned to previous instances of significant health outbreaks, natural disasters, and instances of displacement. So in my research, I mainly used the Zika virus and the Ebola outbreak as case studies when framing COVID-19. However, for additional literature, I used the earthquake disasters in both Nepal and Haiti, and I also used examples from the 2012 Yemen food crisis. So in addition to natural disasters, I also looked at examples of displacement through studies conducted in an Ethiopian refugee camp and the Kenyan Dadaab refugee camp. And as well as all of this, I also read into the success of female world leaders And as I'd seen a lot of literature that was suggesting countries with female leaders were handling the crisis more effectively than those with male leaders. So after studying the case studies, several trends emerged and were prominent within the literature. So firstly, the overarching theme was that women are disproportionately impacted in cases of emergency, and this was due to a multitude of reasons. They are subjected to increases in gender-based violence, which was evident in times of displacement. So, for example, insecurity led to sexual violence in the Yemen food crisis and within the Dadaab refugee camp. They have limited representation in politics. They absorb the burden of unpaid care, therefore further exposing themselves to disease. There are direct impacts on sexual and reproductive health services, which in the case of the Ebola outbreak, this caused higher maternal mortality rates. In the case of the Nepal earthquake, the destruction of schools meant that young girls were at increased risk of forced marriages and transactional sex. So all of these trends considered, I began to conduct research on how women, girls and people who menstruate in the UK were experiencing lockdown. So for my research methods, it had to be remote. It was aimed at all who menstruate. It was based in the UK and you had to be over 18. I used a qualitative method and an online anonymous survey. And in terms of distribution, Freedom for Girls and Irise both distributed it via their social media, and it was sent via Irise's network. So just getting into the findings of the work, the inclusion in political decisions referred to how far participants agreed with the following statement: women have been included in the conversations throughout lockdown. I also explored which roles women had been represented in, so politicians, journalists, social media activists, what platforms they had been viewed upon. And the reason I sort of went down this road is because at the time we were seeing 2.7 men for every woman on the radio and TV programme at the height of the pandemic. And it also reflects the 5 men to 1 woman ratio in the cabinet. So there were 92 respondents in my sample size, and 53% of these did not feel that women had been included in political conversations. 50% disagreed with the statement and 3% strongly disagreed. And 27% neither agreed nor disagreed, so it still wasn't a strong agree on the other side. 71% of respondents stated they saw female representation through journalism and in social media activists. I then asked about sexual and reproductive health services. So the majority of participants had not actually attempted to access the services, and the question was not applicable to them. But it is worth noting this was being conducted at the very start of the pandemic and throughout. So this section explored how accessible participants had found sexual and reproductive health services, as women's healthcare is often negatively impacted in times of emergency. So 25% of participants felt they had been unable to access sexual and reproductive health services. The majority had not attempted, and 18.5% of respondents had felt able to access them. So 19 respondents stated they had attributed the difficulty to the issue not being considered urgent by medical professionals. 14 respondents attributed it to a lack of appointments available. So in terms of accessing sexual and reproductive health services, these are just some sort of quotes that I got from the survey. Somebody said the services were closed. They tried to phone, but it wasn't clear answer phone options. So they were having some issues navigating the service. Somebody said my appointment took place over the phone, during which my suspected endometriosis was dismissed by a male doctor who knew nothing about my situation. And somebody else said the doctor seemed to think the issue was not urgent. My contraceptive implant was due to be removed in January, and I've still not been able to get an appointment. So I also explored self-care. So this section attempted to gauge whether women had the opportunity to adequately care for themselves during lockdown measures. So the majority of participants felt they had been able to self-care. And when given the opportunity to elaborate on this, 3 themes were identified amongst the answers. These were worsening mental health, improved self-care, or a combination of both of these. So 45 participants felt they had been able to adequately care for themselves throughout lockdown. This referred to self-care, prioritising your own health and listening to your body. 28 respondents felt they had not been able to adequately care for themselves, and this was 25 that disagreed and 3 disagreed strongly. So when asked to elaborate on this, somebody said the lines between work and home have blurred. I no longer have set routines. I found myself not getting dressed, not eating properly. Somebody said, I have found it difficult to prioritise my own mental well-being when there were so many stories on the news of people dying from COVID-19. Somebody said, I found that not having any other pressures from the outside world has meant I can focus on my exercise, my diet, my self-care, and I feel more nervous about losing this routine. And somebody said, working full-time, furloughed colleagues, and extra care responsibilities have been quite exhausting. There just has not been time for self-care. So the next thing I explored was menstruation. So this section explored how able participants had been to purchase period products. This factored in financial ability, accessibility, and whether there had been any dependence on others to meet their needs. So those that had experienced difficulty were asked to state why this was. So 49 respondents found it extremely easy to access products, and a further 22 rated it easy. 22 respondents attributed their own difficulty accessing period products to reduced stock in the supermarket, and 7 said they were unable to leave the house. So I think the dichotomy between the data stating many were experiencing period poverty for the first time and that charities providing products were stretched to capacity, it was not reflected within this sample size. Despite commenting on financial difficulty, the majority of participants did not report having problems actually purchasing products. So the next thing I looked at was care responsibilities. So this section explored whether respondents had absorbed any unpaid care responsibilities. Data from previous emergencies has shown that women tend to absorb the extra burden of care, and this actually increases risks due to exposure. Participants were asked to name the care duties they had performed, as well as being asked to rate their stress level as a result of them. So we had 34 respondents that had provided extra unpaid care. This could be sort of shopping for somebody, medication collection, even having somebody move in with you. 40 respondents selected their stress levels as being 4 and under on a scale of 1 to 10, and only 16 respondents rated their stress levels higher at about a 7. So I kind of interpreted this as the lack of stress could be indicative of an attitude that women are expected to undertake these care responsibilities, but I will speak about that a bit later. So the next thing that I asked people to talk about was the gender gap. I asked people if they thought it would get worse, if it would get better, or if it would kind of just stay the same as a result of lockdown measures. And as you can see, overwhelmingly people thought it would be worse, and hardly anybody thought it would improve. So they were asked to elaborate on their answer, and 4 main themes emerged. There was an imbalance of care responsibility, disproportionate employment or economic impact. Women were left out of political opportunities, and some people actually said it may be an opportunity for change. So some of the quotes that I got from sort of allowing people to elaborate were, I think there's a greater appreciation in homes of how much women do and how hard it is to balance work and family. Somebody said individuals were able to play golf, a male-dominated middle-class sport, but women were not allowed to have their partners accompany them to pregnancy checkups and birth. Somebody thought job losses would affect women more adversely than men. Somebody said it's made us realise we're all in this together. And somebody said, I do believe lockdown has been an opportunity to reflect and have conversations on gender inequality. So just to discuss those results that we've talked about. So the majority of the sample in this occasion were able to meet their own menstrual health needs, despite financial difficulty in other areas. Similarity to previous emergencies were visible in terms of women being disproportionately impacted, and high stress levels indicated in relation to employment. There was a correlation between inadequate self-care methods and worsening mental health. The majority of respondents felt the gender gap would worsen or remain the same. Respondents felt underrepresented in the political sphere and left out of conversations related to lockdown, and power and control was impacted by lockdown measures in the UK. So in terms of biographical data, it was overwhelmingly a younger sample of white British people. I had 91 women and one person identified as non-binary. So the dominance of white British cisgendered women is a prominent silence that emerged within this study. And there were a few other silences that are worth noting. I mean, there was a lack of diversity within the sample. There couldn't be undercoverage in the online survey format, and the lost voices of hidden vulnerable. This can refer to sort of people that are refugees, don't speak English, as Tora mentioned, people experiencing digital poverty. So there's also a potential bias due to the distribution channels. Shame can act as a deterrent when we're talking about menstruation. And some are experiencing period poverty for the first time due to lockdown, but this was not applicable to this sample. So I think it's definitely worth considering future research opportunities in light of this study, but with altered approaches. These are the things I kind of noted at the time of publication. So the impact on the biology of periods, this was actually suggested to me by a participant, but by looking at what the previous speakers have talked about, this is all, being covered, which is great. Investigating changes to pain, regularity of cycles and PMS. Using interviews to increase spontaneity. This is definitely something that would have encouraged more in-depth conversations than a survey can offer. Inclusion of the unheard voices, which I just previously discussed, and following up research considering the additional lockdown. So this research was conducted during the first lockdown, and as we know, a lot of people are growing weary and angry with the additional lockdowns. So it's worth thinking about, would the data be different if this was conducted again? So just before I finish, I'd like to sort of reflect on the importance of the topic. The invisibility of women is something that comes through in health crises. So the previous literature highlighted that women are often absent from the framing of a crisis. The data collected emphasised this and demonstrated the ways women felt underrepresented. Period poverty, reports published at the beginning of lockdown stated that many were experiencing period poverty for the first time ever, and the demand on charities was higher than ever. And the gender gap, this was something I included in the survey, and it garnered the biggest response. Only a small percentage of respondents felt the gender gap would improve, and this study demonstrates how women often absorb additional burdens whilst being overlooked politically. So that's it from me. Thank you very much.
Especially seeing how you compare different case studies, and again, similarities across all of the research that we've had discussed tonight. We are going to take some questions now. I've been making a note of those that have come up in the chat, so if there are any additional questions, then do please put them in the chat and I will add to them. Gemma, you've got your hand up?
Yeah, sorry, Bab, you've got quite bad feedback or something going on.
Oh, I've tried putting my earphones in, see if that helps.
It just went really crackly. It's not quite as bad now, but yeah, give it a go. Still can't hear you. Can't hear you. Can you hear us, Emma? Can you hear me?
Emma, you might want to try to go to device setting and change your output and input. You could remember your laptop microphone rather than your headphones. Three dots and then device setting. Oh no.
Sorry, I'm having technological issues. Can people hear me?
Yes, I can hear you.
Yeah.
Brilliant. Okay, so we will go to questions. I've got a note of some questions here. First question that we've got, well, a couple that are kind of related. The first one was for Gemma, and this was about whether any participants had issues with accessing sanitary products during initial lockdown, as some supermarkets did not class them as essential products. And related to that, somebody has commented to say whether there were reports about access to food or hygiene banks in supermarkets and health retailers like Boots and Superdrug, because they've noticed that there's a lot of branches in Birmingham in their local area, but the banks are not always signposted or even open to drop donations.
Okay, so in answer to the first point about the essential items, none of the survey people talked about that, but it was something that some of the organisations that we spoke to in phase 1 talked about, was just that I think it was Wales, wasn't it? There was a report where some supermarkets weren't acknowledging that these were essential items. And other people talked about, so some of the boxes for people that were shielding and lived on their own, local authorities were, in England anyway, I'm not sure about other parts of the UK, but you could get like a care, almost like an essential items care package delivered to you. This was at the beginning of the pandemic. And period products weren't included in those because they weren't seen as essential items. Food banks weren't viewing them as essential items. So again, food banks didn't necessarily have access to products in terms of the things that they were making available to people. So not necessarily from the survey participants, but it was something that other parts that the first phase definitely picked up on. In terms of the I'm not sure if this is in relation to the drop-off points that are set up in supermarkets and like the bins and things that some of them have, which it sounds like it is. I think some of those some people reported that those were stopped at the beginning of the pandemic, because I think people became really panicky about how, and we didn't know how the virus was being transmitted. So those sorts of drop-off points and donation points were stopped by some supermarkets and other places that would normally have them. So yeah, so that was a thing. I don't know how, like food bank donations, I don't know how it worked with them, but certainly within supermarkets and places like Boots and the Body Shop, I mean, some of those places closed for a while anyway, because they weren't essential shops. So yeah, so that I hope that answers both of those combinations.
Brilliant, thank you, Gemma. There's a couple of questions that aren't directed to anyone in particular, but I've kind of grouped these questions because they seem to be about different participants, different audiences. So first question is asking about period poverty for older women, as a lot of the provision for help seems to be aimed at younger girls. So has anyone seen or kind of had findings relating to older women, or know of initiatives that are aimed at older women?
I don't know of specific initiatives that are aimed at older age groups, but we work with partners who will work with all ages. So that's at Bloody Good Period. So we don't work with schools at BGP, but we do work with partners who work with people of all ages. So that will include older women.
Brilliant, thank you, Rachel. Gemma?
Yeah, I just wanted to say that in terms of our data, although most of our survey respondents were from, I mean, we didn't include children because it's an ethical nightmare to try and include children in research, particularly when all the schools were closed. So yeah, our data in terms of the phase 2 survey is for people over the age of 16, like onwards. And we talk to organisations that support everybody. So some worked in schools, some, you know, people like Rachel's just said, Bloody Good Period, Freedom for Girls, you know, they work with everybody and anybody. So yeah, and just to clarify in terms of our data, it's everybody who wanted to take part.
Brilliant, thank you, Gemma. And Tora?
Yeah, sorry, Gemma has covered me actually for a lot of that, and what Rachel said in terms of yeah, who we provide services to. But I want to highlight that in our peer support groups, what's been really encouraging for the Black Women's Menstrual Health Project is that we've had a lot of women who are postmenopausal and perimenopausal and menopausal, and that was important for us for 2 levels that we learned as we were going, which was the lack of information around that experience, as well as particularly perimenopause, before you actually experience not having periods anymore, and how that made women feel in terms of accessing support. But also, and it feeds into the book idea, that is that generationally, so many older women that we've worked with wanted to do so much support for younger women and girls and people who menstruate, so that they didn't feel that they were going through the same hurdles and challenges and barriers and so on. Yeah, that they went through. So, and we're actually asking a lot of our peer support participants to feed into our, our resource that is going to be small for the peer support group participants, but then the bigger one as well. So yeah, there's a lot of community and camaraderie in what we're doing when we do include older women.
That's brilliant. That sounds really good, intergenerational working there and sharing experiences. That's fantastic. We've spoken and we've heard a lot this evening about menstrual health education, and we've been focusing not just on products as being part of period poverty, but also the need for better and more better, wider, more inclusive menstrual health education. One of the questions that was asked, and again not aimed at anyone in particular, but was asking about whether there were opportunities for educating boys and men around periods and menstrual health. Rachel?
Yes, so at Bloody Good Period, we've done a few things in the past. We did have a podcast for a while called Stay in the Room, which was specifically about talking to men about periods, and the title is reference to that anecdote that I think I certainly remember it, and lots of people tell us about, you know, the talk at school for the girls, and the boys get sent out of the room. We're encouraging them to stay in the room. We're going to run an event soon, maybe even in real life, who knows, but it will hopefully be a podcast as well, to resurrect that idea of how we talk to men and boys about periods and how we do that education job better. It was something that came up a lot in the survey responses as well, people talking about how important that is and how it has long-lasting implications. You know, the boys who got sent out of the room 20, 30 years ago are the doctors dismissing women's pain now, for example, not exclusively, but it's definitely an issue.
Yeah, definitely. Thank you, Rachel. Tora?
I have to jump on what Rachel's just said, because before Freedom for Girls did some collaborations with Bloody Good Period, I listened to Stay in the Room, and it is such a good podcast, everyone. You really need to get involved with it. It's funny and it's jovial, and it's also really meaningful. And I've sent it to a lot of my male friends, which has been, yeah, insightful for them, which is good. But yeah, I think for us, because we're much of a small charity, our education for men and boys has been predominantly in East Africa, where actually it's been really successful because the gender stereotypes and the inequalities are much more stark there. So what we try to do is, respectfully on a cultural level, our female educators speak to girls first, our male educators speak to boys, and then we bring them into a room together and we go into the granular detail of what is going on with our bodies. And because of the lack of products in that side of the world, there's also the risk of, you know, the typical problems that you get when you're a young woman and you have your period and you don't have products. So one of our biggest stories and successes was from all the schools we worked with in an area in Western Uganda. When that had happened, teachers were reporting to us that boys were giving their jumpers to girls to wrap around their skirts so that they felt more comfortable. And before the education that we were delivering, it was this idea of just laughing and taking the mick out of them. So we're trying to do our best with that to bring it to the UK, but COVID's just put so many barriers within that in terms of accessing schools, and we didn't want to do that for boys online, so we're just trying to work that out moving forward. Yeah,
that's amazing though to hear like the actual impact that's had on interactions. That's really great to hear. Kerry Osborne said, really interesting research across the board and great to see from different periods, pun. Many of you have noted that getting information responses from women of colour and people of colour has been really difficult. How could we change our approach in order to ensure these are included in research and also that the necessary information is getting out to them? Is that a new hand, Rachel, or a legacy hand?
It was a legacy hand. That is an excellent term. But I
Sorry.
no, I like it. Yeah, I can say a little bit about that. I mean, I think it comes down to making sure that we're talking to all the right audiences in all of our communications. So we have a big focus on making sure that our comms are inclusive, and that we are amplifying the voices of the people we are working with, so that when we come and say, hey, can you fill in our survey, we're already spoken to that audience and we're not just kind of being extractive and wanting information. Not that I'm suggesting anyone who's talked about research would ever take that approach, but I think it's got to be embedded in an overall approach, if that makes sense. And I think the big thing that we learnt on responses was time. So I mentioned that people filled in our survey really quickly. We didn't get all the responses from people of colour that we wanted as quickly. And we really had to be very firm with our partners about, no, we are going to wait until we have the right number of responses in, because we want to hear from those people rather than just end it because they were working on this for free. And of course, they had other paying projects to move on to. So they wanted to go, well, we've got these responses, let's close the survey. And we were firm that no, it takes time. So we're going to take the time that we need.
Brilliant. Yeah, it's really interesting hearing about how to manage those competing demands and ensuring that the work is inclusive and listens to voices that are needing to be heard. Gemma, I think your hand went up next.
Yeah, I think Rachel just made a really interesting point about the funder. Like if you're working with a funded research and timescales and all of those sorts of things. Because I'm really conscious that we had a limited period again for running our survey because of those sorts of restrictions, and that I'm pretty sure that will have impacted on our response rate from non-white people and other marginalised communities. In terms of So the other points with ours as well, so I kind of touched on this at the beginning. The online survey that we did for phase 2 was our very last resort thing that we had in place that we had to bring in, unfortunately. Well, not unfortunately, because we still managed to get data, but we'd always planned to be doing face-to-face focus groups, visiting projects and visiting community centres and kind of having that rapport with people that were accessing services. That was our ideal situation. Maybe we were very naive thinking that we'd be able to do that in a pandemic. But we put our best case scenario forward, and unfortunately for a whole plethora of reasons, we couldn't do that at all. Shifting everything to online was really exclusionary. Digital poverty, as several people have mentioned, was a real problem for a lot of people that we were hoping to work with. So we're automatically removing a huge demographic just on the basis of shifting everything to online stuff and being reliant on things like social media. We were also I'm really conscious that we were asking overstretched non-profit charities for support in reaching people as well, who wouldn't necessarily have had the time to be able to help with those sorts of things. So in terms of our project, those really restricted and obviously have impacted on the fact that the majority of our sample is white women from England. So yeah, I just wanted to kind of say for our project, there are whole issues with doing research and trying to work with other communities, and the whole thing about people saying that communities are hard to reach, and it's like, well, actually they're not hard to reach if you bother. So yeah, that's a whole other discussion, I think, but I'm sure Tora has got way more to say on this than I can.
Tora?
No, I think what you said, Gemma, and what Rachel said as well is really important. I think the survey in itself has been, like we've all alluded to, like it's been so difficult during the pandemic. I think for me, in terms of the question itself, how do we get people of colour more involved in this? It's about the visibility of what the work it is that you're doing, and it's also about the representation. That's what we've learned quite quickly. So tackling that on a multifaceted approach is what our project has tried to do, and each time that we do take a different approach, non-traditional, so not through the newsletter, click on this link, follow the Survey Monkey link, but we've gone, like we said, into the community, or we've approached specific groups, or spoken to community leaders about what do you think how that will work, and can you be involved? Can you also be a supportive face of the message as well? Because that is such an important thing that we've learned about the recognition of what people of colour need. It's the trust, and it's the acknowledgement that someone like them is bought into what the message and the aims of the project are trying to do. That's been absolutely one of our main learning areas, which we were already aware of because we know what that means. And like I said before, in terms of the beneficiaries that within the project, myself and a couple of other girls, we still need that broader representation because of how embedded racism is in our culture in some ways. So yeah, I think it's the representation aesthetically and through messaging. And then simultaneously, it's about exploring different options and being patient. I think Rachel said that as well. It's not about let's close it at this date and it doesn't matter. We want the information from you. And we said as a team, we'll go to, so many lengths and time lengths to get that sorted, really. Yeah, thanks, Emma.
Brilliant, thanks, Tora. Yeah, I think definitely representation was something that was really important that jumped out from your presentation and your findings, and across all of the sort of speakers tonight. Actually, the importance of education and empowerment for the women and girls and people who menstruate that services initiatives work with, is in terms of not just addressing perhaps access to products. Obviously that's an important element, but also thinking about elements of I think Tora mentioned in her presentation, actually enabling choice of products and bringing in this aspect of it's about dignity and yeah, addressing wider structural issues of poverty in response to that. We are coming towards the end now. Unfortunately, it's gone way too quickly and it's been a really amazing event. So thank you very much, everyone, for attending. Perhaps the kind of final thought, one of the comments was about putting the chat about putting pressure on the government to continue the period poverty scheme in schools and thinking about the environmental impact of period products, so potential wider structural issues that we can think about going forwards. This presentation event tonight will be recorded and available to those that have registered for the event. And I just want to say a really massive thank you again to our speakers this evening, who have been absolutely fantastic, and it's been a really interesting event. So thank you, everybody, and thank you to those that have attended.